a bit of the German socialized healthcare explained, and why Americans don't want it. Let's go.
Number one, mostly because Americans don't really know any different. Only 42% of Americans even own a passport.
So only 42% of Americans own passports. What that means is nobody gets out of the States. Nobody leaves the States. Nobody gets a chance to see how different it could be elsewhere. When you're stuck somewhere for so long, and when no one tells you different, you never get a chance to see what things are like outside of it and away from that.
Not only do they not leave the U.S., but a lot of times are not even in said foreign countries long enough to really get into the nitty-gritty of how those countries function, which would include how their politics and their healthcare system work.
Exactly. So when people travel, they're not out long enough to even see. Even if they get into good conversations or meet people outside of the country, they're not there long enough to really witness it and see it firsthand and understand how good different ways can be. It's pretty sad when you think about it.
Unfortunately, like I said, Americans don't get outside of the U.S. to realize there are other options. There are other ways of having a healthcare system where everybody can have access to affordable healthcare. So that is a big reason right now. It's just lack of knowledge. Reason number two is that it has the word socialism in it.
I have friends that when I bring up, or when it's brought up, anything, any word or particular topic that has the base word socialism in it, they run the other way. They completely turn a blind eye. They do not even listen, because it is automatically assumed that because it includes the word socialism, it must be bad. There's only one example that most people bring up when it comes to socialism, and that's Venezuela. That's the one example everybody always brings up. But there's more things to having kind of like socialist pieces of a particular type of government. It doesn't mean you have to be a full this or a full that. I've always maintained that if you add just a little bit more of what socialism brings, the states would probably improve a little bit. I mean, that's just my opinion, but let's keep going.
A lot of Americans are still against anything that has the word socialism in it, which is, yeah. I mean, the Cold War ended in 1991, guys. We also need to remember that there are a lot of other programs within the United States that are already socialized, like education, our police department, fire department. We already have concepts of socialist programs in our country. Why can't we extend that to healthcare? A lot of people haven't quite made that leap yet, but mostly because it has the word socialism in it. Reason number three is that Americans are under the impression that socialized healthcare will actually cost more than their current healthcare system, which is not true.
Which I don't even understand. I think most people who even think about a socialized healthcare system think about paying less. Maybe I just don't know, but I don't know a country out there that uses a system similar to what Germany uses and ends up losing out. Now, I know the money has to come from somewhere, obviously, but aren't you better off in the end? Wouldn't you want that for your kids? If you don't care about yourself, wouldn't you want that for your children, the people you love?
The health insurance coverage in the U.S. in 2017 was 91.9%, which left 8.8% uninsured. And that's the equivalent of 28.5 million Americans. And that's also, we can't forget the even larger number of Americans who are underinsured. And underinsured means that you have health insurance, but it actually really doesn't cover anything. It's useless. On the other hand, Germany, their health insurance, 100%. 100% of the population is covered.
100%. 100%, yo. I mean, come on. This is just so no-brainer-ish to me. I don't understand. 100%. I faced this where I've had full coverage insurance back in the States. It did shit for me. Like, what's the point? What is even the point? I was paying so much money. I don't even want to go into it, but I was paying so much money for healthcare back in the States. You got no idea. And there's so many things that it just did not cover that I had to come out of pocket massively for anyway. On top of it.
Reason number 4 is wait times. We are told by our politicians to wait 6 months before you can see a doctor. And by doctor, I mean like house thoughts, general practitioner. No. Reason number 5 is lobbyists. And this goes back to the whole politician thing because unfortunately lobbyists are the shit stain of the American country. And the reason why we can't have nice things in my home country. That not only includes healthcare, but like reasonable gun laws and other nice things. We don't have them because lobbyists have deep Yeah, they have deep pockets, and our politicians are greedy. Yeah, that's a big reason. Health insurance lobbyists make so much money, and they are working very hard to make sure that we do not change anything about our current dumpster fire of a healthcare system.
As long as we empower the rich as much as we do, things will never change. People with money will always control things in a government like in the U.S. U.S. is all about money. We know this. Lobbyists. Terrible.
And reason number 6 is the U.S. doesn't really have a sense of community compared to the Germans. I mean, Americans are very much about individuality.
Now, I already know what she's going to say with this. So in the States, those that feel like they've made it and have become successful feel like they did it. They want everybody else to do it on their own. I did this. I climbed from the holes and I got my own money and I came from poorness and I did this and I did that. Oh, somebody else is going to have to do it on their own. I don't want to help them. I don't want to contribute to other citizens being good too. I want nothing to do with it. I did it on my own. You can do it on your own. And in a way, in a small way, I kind of understand that, but I look at the big scope of things. I mean, for example, look at the homeless. Look at the homeless in the States. It's just bananas. It's crazy. It shouldn't be that way. With as many millionaires and billionaires we have in the States, why do we have so many homeless? It's ridiculous. So this individualist versus community mentality, 100% true. I mean, it's frustrating sometimes, you know what I'm saying?
And part of it, like I said, it comes down to this whole individualistic mentality. Like, one of the biggest arguments I hear is like, I pulled myself up by my bootstraps, and so did my pappy, and so did my grandpappy. So why should that poor American get a free ride? I had to work for what I get. Being poor is a choice, so they shouldn't get a free ride. You know, that is literally an argument I hear all the time. I remember when I was old enough to start to understand these arguments that were, floating around. One of the biggest things I heard was, why does healthy American A have to pay for unhealthy American B who chose to be a smoker and therefore got lung cancer, or chose to eat American junk food and therefore got diabetes? Like, that is one big thing. Like, why should I have to pay for that? I'd rather just pay for myself if I get sick, and if I'm not sick, I save money. Woot, woot, woot. And that is literally like the biggest argument that I've seen against socialized healthcare, saving money. So I say we Americans have, this little sense of community. I mean, not that we don't care about other people, but we don't look as America we don't look at the country of America as a whole community. Our community only extends to like our association, like our clubs or our sororities or fraternities or our churches. It is the community we can physically see. That is our community. And it's very much like out of sight, out of mind. If we don't see them, then they're not important to me. To hell with everybody else, because I'm just going to take care of my people. So it is very easy to have that mentality. But for example, like I've had relatives that have gone bankrupt because of because of their healthcare bills. So for me personally, I've seen firsthand how the system just doesn't work. So of course I'm like, get on my high horse and I want to fight this injustice. I know a lot of people that if they didn't have that relative or they didn't see that firsthand, they would automatically be like, hell, I even see relatives that know about this relative who has had this problem and still be like, well, that's your choice. Germany created their health system back in 1883.
And that's what I like about Germany. Most Germans I know are kind of forward thinkers. And in that regard, that came in handy because you see how it worked out with their healthcare system. What'd she say back in the 1880s? It's working, bro. The
U.S. at that very same year was actually going through its second great wave of immigrants. These are people that, we didn't have the idea of a safety net. We weren't thinking about that while Germany was thinking about that. Because, when you were an immigrant in the U.S., you came and you knew that you had to work. If you got sick, you couldn't work. And if you couldn't work, you couldn't get paid. If you couldn't get paid, you couldn't provide for your family. It was that simple.
And that's the situation that a lot of people in the States face. They can't afford to not work. They have to go to work. That's just the first thing. They're faced with having to go into work because they need to make the money. Secondly, sometimes when they shouldn't be at work, they don't have the sick days that awards them the time off of work. So they have to go to work. Seeing it over and over again. It's frustrating and it's kind of ridiculous. You got people that just can't afford to not be healthy. But then the healthcare system doesn't support that fully. What kind of circle is this? It's a crazy, wicked circle. It's just nuts.
But in the US, it's like, no, it's still like not caring about the community. It's still about like thinking of the self. I can work hard. I can show everybody that it doesn't matter how sick I can get. I can still get the job done because, my ancestors did it, and I had that blood is flowing through my veins. And if they can do it, I can do it. And that whole thing, like, it does inadvertently cause a lot of Americans to literally weigh their entire self-worth and their value and tie that to their jobs. But all of that mentality then, causes us to kind of be workaholics and always try to find ways to whatever we do, we make money off of it. And unfortunately, there is no entity that abuses this mentality more than the employer.
And I don't think anybody's arguing the fact that we know that the States is multiple times over bigger than Germany. It would have a steep hill to climb in order to get something implemented like this. But can we at least see people who want to start the process, who want to get the ball rolling on this? That's what it's hard to see it and a light at the end of the tunnel. It's hard to see the hard times coming to an end.
I think if I want to try to look at, the positive out of this whole situation, I really do think that Americans are waking up to the fact that we need something better. And the idea of socialized healthcare, I do think that I will see that in my lifetime. I don't know when. I hope it's before I have grandchildren. But I do think it is possible. We are moving in that direction. I feel like most of the people that are really fighting it are the much older generation. Not all of them, of course, because like my dad is a boomer and he is absolutely for, like, he sees how my life here is in Germany. He's like, yes, what you have, we need to bring that to the States. Like, yes. So I don't want to like lump boomers together with that.
I agree with her. I believe that at some point, somebody will finally take a stand and be brave enough to try and implement some stuff that actually works for the American people. Because, people like me just sit back in the States and have to take it and suffer and like know that there's a better way, but be powerless to try to implement something. It's got to stop. It has to come to an end. So that was, I think, 6 reasons why she said Americans don't want socialized healthcare. All 6 of them are valid. Now, one thing I want to tell people is people aren't just against it just to be against it. A lot of it is just not knowing. A lot of people just do not know any different, and they need to be shown. America is not well known for showing people better ways to do things in America, except if you're making someone else money. As long as you're making money for someone else, they'll tell you ways to do that. But you'll hardly get the information you need to have a better life. And that, my friends, is pretty fucking sad. All right, so thank you for watching this short video. I just wanted to touch on this because I ran across this video on YouTube. Also, the only thing that I ask and appreciate and hope that you don't forget is that you thumb up the video. I'm Christopher, and I'll talk to you guys in the next one.